Senator from Washington.
Mr. President, I come to the floor tonight to join my colleagues to raise concern about a proposed Senate health care bill that might move through the United States Senate, as my colleagues are pointing out, without hearing, without attention to the details, actually almost in secret. I guess it'd be secret if we didn't know exactly what was in the House bill. It'd be even more secret, and people have said it's probably going to be 80% of what's in the House bill. Well, I can tell you I agree with President Trump. That was a mean bill. And so if it's just 80% mean, I guarantee you it's still going to be mean. I say that because I've been at home listening to my constituents, and they do not appreciate one bit if you're Harborview Hospital and you're our public hospital and you are going to cut $800 million out of their budget because of your cap on Medicaid, and you are going to leave a regional hospital without resources, they are mad. If you're talking about Children's Hospital and Children's Hospital sees children who are on Medicaid and they're not going to be able to see those children or get coverage, they're mad. Or just like yesterday, or actually Saturday, I was with veterans in Vancouver, Washington. People don't understand, but veterans of the United States of America do not get all their health care coverage through the VA. They get it with Medicaid at individual clinics and services. I have met several of these people in my state, and they've told me point blank, without access to Medicaid, they would not get the benefits they need as veterans to our country. So I think it's mean to break our promise to veterans and not give them access to Medicaid. And I think this whole discussion is basically the fact that we're doing this, trying to box with these guys on a proposal. If their proposal was so great, come to the Senate floor and just don't even talk about the bill, talk about the principles. I want to know, in the Republican proposal, what ideas do you have to lower costs, increase the quality of care, or improve access? That's the milestones by which you should be debating health care. Now, if your goal is just to cut Medicaid and cut people off of Medicaid and cut their benefits so you can give tax breaks to the rich, okay, you might convince me that, yes, you have a proposal, because I think that's exactly what your proposal is. But if your proposal is about reducing costs, then come out here and debate it. Don't even tell me what's in the bill. Just show up on the Senate floor and debate us and say, here is our idea for reducing costs. I will tell you what my idea of reducing costs is, because I wrote it into the Affordable Care Act, and some states are doing it, and it was a good idea. It was called Give the Individual Who Doesn't Work for a Big Employer the Ability to Negotiate with Clout and be bundled up with other people. That's what they did for the working poor in New York. 650,000 people in New York are now on something called the Basic Plan. Why? Because they didn't work for an employer that could negotiate a big discount for them. But we said on our side of the aisle, why would we let poor people just get thrown around in the market and not be able to drive a decent price? I call it the Costco model. So we said to them, you know what? We're going to let you be bundled up like a big employer does, and you're going to be able to drive a decent price in the marketplace. That plan is giving a family at $40,000 a year of income and 4 individuals in the family a yearly annual premium about $500 instead of $1,500 on the exchange. So that's an idea. So come out here and discuss that. Come out here and discuss that. Or if you want to tell me you figured out a way to give better quality of care, I'd love to hear that idea. I'd love for you to come out here and tell me how you're going to deliver better quality of care. Because I can tell you there are great things in this bill that are about quality of care. They're about improving the way that organizations deliver care so that they are rewarded for basically delivering better care. The whole idea of accountable care organizations are so that you put the patient at the center of the delivery system and you reward them for doing a good job of delivering better outcomes. We have innovated. We've innovated in this plan. And if you're talking about access, come out and tell us, what proposal do you have that's about increasing the access to health care? I'd love to hear it. Because in this bill, we already did that too. We said, you know what, it's kind of crazy and expensive to think that everybody who ages, particularly on a Medicaid budget, should spend time in a nursing home. Why? It's more expensive costs, and I don't think I've met one Washingtonian that told me they really wanted to go to a nursing home. They wanted to stay at home. And so we wrote into the Affordable Care Act incentives for states to change the delivery system like we had done in the state of Washington and deliver affordable care at home in their communities. So deliver community-based care. And by gosh, actually, some states, Texas, Arizona, Indiana, other states took us up on it. They said, what a great idea. We want to reduce costs. So if that's such a great working aspect of the Affordable Care Act, and you think it works and it increases access to care by giving people community-based care and reduces our overall Medicaid costs, come out here and talk about it. Talk about what you want to do to put that program on steroids so that more people in America can benefit from better access to care and don't think that they're going to spend their last days in a nursing home. So that's what we should be debating. But we can't even see or hear or have a hearing about what this proposal is. And yet my colleagues can't even come out here and throw a concept on the table. But I tell you this, the fact that you want to affect over 1 million veterans who have fought for our country and you are going to cut them off of the Medicaid care that they deserve to have access to, that is a broken promise. And it's just as broken a promise as what President Trump said. President Trump tweeted, he tweeted this, he said, I was the first and only GOP candidate to state that there will be no cuts to Social Security, Medicare, or Medicaid. That's what he said. So I'm not surprised he calls it a mean budget, but he should also own up that it also cuts Medicaid. Now, we all have an office budget here. I see my colleague from Virginia here, and if we took our office budget and we said we're going to cut it and cap it, and next year it's going to be lower, and next year it's going to be lower, and next year it's going to be lower, and next year, in perpetuity. That's what their idea is to put a cap on Medicaid and cut it in perpetuity and basically cut it out of existence. Well, I don't know why they're beating up on Medicaid, because Medicaid has provided great stability to so many people in our country. They've lifted people out of poverty, provided health care, stabilized communities, and raised the economic standard of living in great places in our country. I received a letter from a superintendent from the Vancouver School District. He wrote to me about the devastating impacts that capping Medicaid would have on his students. He wrote, quote, our school-based Medicaid programs serve as a lifeline to children who can't access critical health care services outside of their school. And he goes on to say, restructuring it to per capita would undermine our public schools' ability to provide for the neediest children access to vital health care insurance. So why would we do this? As I met a veteran, Christina. She's 46 years old, and she's also a full-time student. She suffered from chronic and disabling physical injuries and needs a high level of care. But the care she gets from Medicaid helps her access the medication that manages her chronic care and keeps her going and is working towards that degree. Why would we cut somebody like that, a veteran, off of Medicaid just because someone's idea over here is to cap and reduce Medicaid? So these stories are all over the country, and people are wondering, why would you take this level of investment in Medicaid out of our entire economic system? Why would you impact our school districts, our regional hospitals, our veterans, our Medicaid population? Why would you affect a community that has a large Medicaid base and that is the way they serve them? Our hospitals have told us we have stabilized the increase in health care costs because more of the population was covered and had access to Medicaid. You rip that back and we will be back to skyrocketing costs with people in the emergency room, no access to care other than that facility, with impacts to everybody on private insurance and on Medicaid. So it's just not a good idea. So I ask my colleagues, come out here, don't say you want a patient-centered healthcare delivery system, because we're all for that. And we actually put things in the Affordable Care Act that did that and are working. So if you want to make that claim, come out here and say, what is it that you don't like about the patient-centered delivery system that's here and how you want to change it? If you say your proposal increases access to Americans, let's hear it. If it's about better quality, but I don't hear any of that. I just hear a drumbeat by some people who want to be heartless and cut people who have access to health care, people who are less fortunate in our society, because you want to cut Medicaid. The president promised he wasn't going to do that. I would ask my colleagues to live up to that, and let's start talking about the substance that truly will increase access, lower costs, and give better care to our constituents and the people of the United States of America. I thank the president, and I yield the floor.
Mr. President.
Senator from Virginia.